What is the most painful and comfortable medical procedure you ever went through? Story: 135 chemo treatments. Every 3 weeks for 2 years. It felt like being disassembled. The pieces ran over, then put back together with a handful of bits left over. It was like that for about a week after each treatment. Now in remission and doing okay. Story 2. I had sinus surgery some years ago, and to make sure my sinuses didn't heal themselves shut, I had to visit a specialist ENT who shoved a sharp object up my nose all the way into my sinus cavity and scraped the scar tissue off the inside of my sinuses. Even with the numbing, it hurt like a, and it took several visits before they were satisfied. IUD insertion. Never ever again. Story 3. Most painful was post-C-section uterine massage to cause the uterus to contract after birth with no labor, with no pain relief. My spinal has worn off, and the nurses refuse to follow my RX pain plan. Most uncomfortable is having a urinary catheter in for days. Story 4. Non-lactational mastitis. It's rare when I told my doctor I was in pain, she blamed my period and said, "I'll be fine." A couple weeks passed, my tripled in size. 104. 8 fever. So much pain. Went to the ER, had emergency surgery. I was in sepsis shock. The hole was so big that they couldn't close it. So every day for the next 2 weeks, I had to take the gauze out of my wound and repack it. It was an awful burning pain. It came back, and I had to repeat it all. Thankfully, it's gone now. Story 5. Colposcopy and a LEAP procedure. Colposcopy was done without anything for pain except ibuprofen. For those who don't know, it's pretty much like taking a hole puncher to your cervix. LEAP was done, but I wasn't medicated enough. Because having an electrified wire pass through my cervix and feeling every bit of it, doctor didn't listen when I said I require more lidocaine with dental, and getting stitches was awful. OBGYN care is barbaric, and you can't change my mind. Story 6. Unmedicated hysteroscopy. I've had 2 C-sections, dengue fever, and cut a finger off. The hysteroscopy was still the worst pain I have ever experienced. Story 7. Being induced is awful. Pessaries tucked into your cervix, multiple examinations, a balloon to manually dilate your cervix, then the knitting needle to break waters and the hormone drip to make you contract. All followed by an emergency C-section, which I then had to recover from, and an infection to top it off. Story 8. After my first C-section, my uterus wasn't contracting back down to size the way it's supposed to. The nurses took my husband out of the OR, told him they'd have me right out, and 4 nurses came and pushed as hard as they could right where they had just sewn me closed, while one was elbow deep in me massaging it from the inside. I felt like I was in another dimension, and I could vaguely hear one of the nurses asking me why I was screaming. I actually couldn't talk about it for close to a year after my baby was born. The pain was beyond anything I can describe. My husband said from outside the OR, it sounded terrifying and he thought someone dropped the baby or something terrible happened. Story 9. I had a hematoma the size of a marshmallow removed from the shaft of my winky, which caused so much pain, I still remember it in full color. I had to shower every day and let warm water flow over the open wound, and it felt like pouring lava and glass on it. A pain worse than anything I've ever experienced. It took 18 months for the skin to grow back fully, and in that time there was no pleasure time at all, or it would just split the skin and bleed for ages. Story 10. IUD insertion pap smear. It felt like they took a toilet brush, shoved it in my, and just skash, 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 skash. IUD insertion was uncomfortable until the little arms on the IUD device shoot out to hold itself in place. Jesus Christ, it felt like I got shot. Story 11. First IUD placement. Never mind the actual pain of the gyno clamping my cervix open. Apparently because they had me drink a whole bottle of water beforehand so my bladder was full, they wanted to ultrasound after to confirm placement. My tilted uterus was even more out of place and he had to dig around to get it placed. After dropping the original IUD on the floor, I got to sit and wait with my cervix clamped while his assistant went and got another one. I almost passed out twice. I had such terrible cramping for 2 days after, also. I had a different doctor, whole different office this last time, no full bladder, and was done in less than a minute and a half, with minimal pain, only some discomfort. Makes me wonder what the other doc was doing. Story 12. An amniocentesis done through the placenta. I have a decently high pain tolerance and nearly blacked out from the pain. Huge needle is pushed through your pregnant abdomen and placenta into the fluid around the baby. You can't move and it's not numbed at all. Women's health sucks. Story 13. For me, it was an endometrial biopsy. I'm not a virgin, but it's been 8 years since I last had, so it was very painful, and I bled heavily after. Doctor was concerned he damaged the canal due to the speculum, and suggested I get a dilator set so I can have more comfort, but I have yet to get one. I don't think I ever will because already was painful. That was agony. Story 14. Cervical biopsy. No. Anesthesia. They're cutting pieces out of a very sensitive area. They claim you're just going to feel some pressure. Absolute bullshit. What was supposed to take 15 minutes took an hour because they couldn't get a good angle to collect a sample. Story 15. I had a testicular torsion. Do not recommend. Firstly, I was a teen and never heard of such a thing, and figured it was a case of mythical blue, because it went away if I did the thing that would make blue go away. Except the last time, it didn't. I had managed to get to sleep for a while, and woke up with the sensation of somebody standing on the right one. I stumbled to the bathroom, did the thing, then took a shower, which also didn't help. I then decided to lay on the bathroom floor and moan. This also didn't help, but did attract the attention of a parent, who asked questions about my unusual behavior, and then rushed my dumb to the hospital. I could not put on pants at this point, so I hiked my jeans to my waist and left them unbuttoned. I had to ride fully reclined to avoid any contact with the stricken nugget. The ER sent me to a room to wait for the urologist on call. As it turned out, he was new to the area and the position, and got lost in the hospital for a while. At this point, my testicles' attempt to strangle itself had limited the blood flow until it swelled to the size of a small orange. As an undetermined amount of time went by, I resumed my earlier tactic of moaning and hoping for death. I distinctly remember thinking I would not be able to withstand torture, because my list of things I would not say to end the pain was a blank sheet. When he did finally appear, he quickly explained what was going on, and that he would unscrew it for the time being, but I would eventually need surgery. He also stated the untangling could be done with anesthesia, but that would make difficult to tell if he was twisting in the right direction. On the first attempt, he twisted the wrong direction, and I can assure you it was not difficult to tell. Story 16. I had an EMG a month ago, waist to toes. I think I actually would wish it on worst enemy. For those who don't know, it involves needles and electroshocks. A lot of both. At the same time, ETA and IUD insertion. The onky reason this ranked higher is IUD took a second. This took an hour. Story 17. Getting an ingrown toenail removed. Sounds mild, but it is very painful due to all of the nerve endings in the toes. Also, the stitches went through my nail, which made it look extra gnarly. The worst part about it was that it wouldn't get better at all for the first 3 days, and it was excruciating and felt like it wouldn't ever end. Edit getting a lot of replies by people who have suffered a similar fate. Best wishes to all of you. Story 18. Uterine biopsy. I've birthed children naturally, had teeth pulled, surgeries, lacerations requiring dozens of stitches, bruised ribs, broken bones, etc., and nothing compares to the pain of a uterine biopsy. Story 19. Getting my IUD, hands down. I've had cysts on my ovaries, I've broken bones, gotten tattoos, been in a couple major car accidents, so and so forth. I'd never passed out thrown up from pain until after I had one put in. These women have the audacity to say just take ibuprofen. You're fine to drive yourself home. Yeah, that. Not only should I have been numbed and possibly sedated, I should not have been allowed to drive. I could barely focus, in so much pain and just trying to get back home. I was pretty much bedridden all day with a heating pad. It was awful. Those doctors who just straight up lie to you, especially as women, they should be ashamed of themselves. My partner has had a vasectomy, and his experience was vastly different from mine. He was numbed and given a Xanax, and wasn't allowed to drive himself home. It's nothing short of absolute bullshit the way women's reproductive health is handled, having an IUD inserted. No local anesthesia, had never been pregnant. I can still feel the pain. Story 20. Colonoscopy. Uncomfortable. Not painful at all, but the prep you need to go through is PETA. Basically, you drink like a gallon of liquid laxative that essentially completely cleans out your insides so they can get the camera up there. You are on the toilet for hours. Story 21. Radiation therapy. I had to be flat on my back in a large tunnel. My arms were over my head for an hour every day for a month. Radiation exhausts you. I was on a lot of medication to keep food down. I was much younger than most of the other folks in the waiting room. 0-10 experience, but it killed my cancer. Story 22. I have had both a uterine and cervical biopsy done at different times with no anesthesia. 4 segments were taken both times. Also had a hysterosalpingogram dye injected into your uterus for an X-ray. Those were all uncomfortable and painful. Story 23. Been fortunate so far to not have anything major yet, but as a teenager I had a massive zit on my right nostril that wouldn't go away, so we went to dermatologist who stuck a gigantic needle in it to give a shot of something. It brought me to tears since it was right next to my freaking tear ducts, lol. Story 24. I had a cyst growing on a root of a tooth that was pushing into my sinuses. My face felt like it was going to explode. The second the dentist pulled the tooth, the relief was instant. I've given birth without any pain drugs. I've had migraines last weeks. I had 5 months of chemo, surgery, and radiation treatment that burned my skin. The cyst growing into my sinuses was the worst pain I've ever experienced. Story 25. I honestly have medical trauma from all the issues that have gone on. I refuse to see an OBGYN ever again. After last visit, the radiologist misread an ultrasound report, and they had me thinking for 3 weeks I had guaranteed cervical cancer. I was saying goodbye to my kids and everything. Once the doctor got back from vacation and did the procedure wide awake, all 3 males in the room panicked and said, "They got the measurements wrong." Stopped everything. Nobody consoled me or apologized. It was just all 3 of these doctors and techs pissed off at the radiologist. I did get a call apologizing for the improper reading, and all bills were written off. The labor and delivery of my son was actually worse and even more traumatic. I won't even type it out. Wish everyone love. Story 26. Pap vaginal exam or root canal. They gave me all the numbing they could possibly give me, and I still felt every horrific second of the root canals. Vaginal exams are just awful, especially when they scrape up some tissue. You don't get anything for discomfort or pain. If you want something similar, use a cheese grater on your skin and then spray the wounds with salt and lemon juice. Story 27. I had a 9mm kidney stone stuck in my bladder for nearly a year. It had razor-sharp spikes that had hooked onto my bladder wall. My urologist had to go in after it and fish it out. They do that by shoving a tool that has a camera and grabber up your urethra into the bladder. It took several tries to get it to release from my bladder wall and then slipped out of the grabber halfway out of my. Those razor spikes promptly snagged on the walls of my urethra, and the doctor had to go back in and free it to complete the extraction. This whole thing is done while you are fully awake and can watch on the same monitor the doctor is using. I've had many kidney stones, had many kidney stents, and several rounds of lithotripsy. But having this monster forcibly extracted was the worst of them all. Story 28. I had some severe dryness in my eye and wound up having to have them scrape the eye clean and put on a patch of new skin cell stuff on top of it. They said I should be fine with ibuprofen once the anesthesia wore off. Morgan Freeman voice. He was, in fact, not fine. I had to pull over and curl into a crying ball in the back of my minivan till I could force an eye open long enough to call those and scream at them. Story 29. Bunionectomy. They say it's worse than childbirth, and it was. A lot worse, and I have the constitution of a Clydesdale. I couldn't walk to my car for 8 months. If you have to do it, make sure you have adequate pain management. A lot of adequate pain management. Story 30. Table saw injury to my index finger and thumb, requiring ER to sew it all back together, and numbing didn't work. Screamed like a little baby. Then 2 weeks later had hand surgery to correct the mess. Thankfully, under general anesthesia, unconscious. Saved both digits, although my index finger is missing a third of the tip and looks more pointy. Have no feeling along the outside of the index and inside tip of the thumb. So I've lost tactile sensitivity, and holding small things often results in dropping them. No more blindly threading a nut on a screw. Can't feel it. Story 31. The most emotionally difficult and comfortable has been bladder cancer surgery and treatment. I was anesthetized for the surgery but sent home with a catheter. Imagine going home and spending days with a tube sticking out of your urethra, connected to a bag that needs to be emptied periodically. Not fun. And all immunotherapy chemo treatments are given directly to the bladder by way of a catheter, and am wide awake. For the guys out there, you haven't felt real discomfort until you feel a catheter pushed past your prostate. That will make you sit up and take notice. It's been worth it so far though, as no more cancer has been detected in 18 months. Story 32. Being stuck in a dialysis machine 4 hours every 3 days was pretty crappy. Not being able to move, watch out for those crazy killer nurses, they are real. Story 33. I had gum grafting surgery and they took skin from the roof of my mouth. That recovery was either that or getting a spinal headache after a botched epidural during the birth of my first kid, plus second-degree tear. I had this newborn baby and literally could not raise my head more than 3 inches, or I'd have debilitating pain and blackout. Doctors told me I pulled a muscle in my neck from pushing. Took them 48 hours to figure it out, and finally gave me a blood patch since my spinal fluid was leaking. Story 34. I was having intrathecal chemotherapy and they struck a nerve in my spine with the needle, so my leg started spasming violently, most excruciating pain I've felt in my life, besides my lung collapsing. Stage 4 cancer at 17. Not fun. Story 35. I had to have my last IUD ripped out of my uterus as it had embedded itself in the wall and they said it was too late for painkillers. I can't tell if it perforated the wall or not, so if it keeps bleeding, go to ER. Like, Yautaf? Story 36. Hemorrhoidectomy. Procedure itself is fine. Recovery is relatively swift. But the first 48 hours is absolutely terrible. Unclean area, open wound over a muscle sphincter in an area that's supposed to give alarm signals if something is amiss. The pain was so severe and shooting I started fainting when I coughed, moved wrong, went to the toilet, or breathed wrong. What makes it worse is that you realize it's really quite a minor thing happening down there, but it feels like you're dying. But it's just a few scrapes and cuts in an unfortunate place and all of a sudden you feel like you're dying. I've also given birth unmedicated and walked on broken bones, and yes, I have combined those two when I took my cast off while giving birth. It's absolutely in the same category of awfulness, if not worse. Story 37. Colposcopy. Literally could hardly move for days. It's literally someone hole punching your insides with zero anesthetic or numbing. They told me to take a Tylenol beforehand. I've had multiple IUDs and surgeries and nothing was as painful as the colpo. Almost threw up. Story 38. I had a cervical biopsy and 2 IUDs, both done by female doctors and nurse practitioners. Still astonished that neither of them offered, knew, or fully understood the pain they were administering. Like most, I was just told to take Tylenol or Motrin prior to coming in. When I went for my second IUD, I was petrified. I liked the way the IUD worked and had to stop oral contraceptive due to rising blood pressure and continued need for high dosage of the birth control, which increased blood clot and stroke risk. I almost passed out from my IUD insertions. When I had my cervical biopsy, my doctor at the time had to get 3 samples. Claims she missed the first time, girl no you didn't, and didn't get a large enough sample the second time. This provider was forcefully removed from the hospital where I had this done. Story 39. The biopsy of my uterus was pretty freaking painful but very quick. The most painful test I had done, but I went to lunch afterward and then took a nap. Recovery from egg retrieval, 31 eggs. Retrieved was tough for a few days, but it wasn't that bad. Recovery from my first C-section was more mentally tough than physically. I was being extra careful at the thought that I might hurt myself. I had been in labor for 66 hours induced before the C-section, and even that wasn't too bad physically. Recovery from my second C-section was tough, because my baby was in the NICU an hour from home for 2 weeks. I had my tubes tied at the same time as my C-section, and had more pain from that area than the incision. I had to make that ride every day and walk from the parking lot to the NICU. That took a toll, but the recovery is fairly quick considering. I weaned myself off pain meds after a few days so I could drive myself when I needed to. Story 40. I got an infection in the pad of my middle finger. When they cleaned it out, they gave me a local, then packed it so it wouldn't close up. I went back to get the packing removed. They did not numb me. I've had multiple natural births, kidney stones, gallstones, bladder stones, appendicitis, and a body full of tattoos. This was by far the single most painful thing I have ever experienced. I lost vision, I lost speech or any ability to vocalize. My brain went dark. There are no words for that level of pain. Story 41. Colposcopy, without a shadow of a doubt. 2 of them in quick succession followed by an immediate smear test. That was painful. Punch biopsy. And I have had multiple children. Doctors don't seem to believe that taking pieces of your cervix out might hurt, so they don't bother with any kind of painkiller. The nurse had to hold me down. I'm not a sickly person, never been sick, never broken a bone. Only labor. And this was an anticipated pain. The punch biopsy was a total torturous surprise. Story 42. I have vaginismus. Basically, my pelvic floor muscles don't work as they should, which makes incredibly painful if not impossible. Treatment isn't a one-and-done thing. You need to work at it all the time unless you want to relapse. Physical therapy involves someone putting their fingers into the vagina to manipulate the muscles. It hurts a lot. On my own time, I have to dilate, which means using shaped silicone objects to retrain the pelvic floor muscles. This also isn't always pleasant. I hate it. I wish I didn't have it because I love when it doesn't hurt. Story 43. I got stung by a jellyfish snorkeling in Panama, and we were not close to a medical facility. The tour was non-professional and led by 2 young men, but were recommended as trustworthy. While I was swimming, I felt a sort of static run past my right knee, and I immediately went into survival mode, sprint, swimming back to the boat. The 2 men quickly rounded up the rest of the snorkelers and sat me down on the boat, which caused the poison from the jellyfish to pool into my groin. This was the worst part. I felt like my leg was either going to fall off, or if it didn't, I wanted someone to cut it off. I was taken to this beach from a location which we did not leave from, and I was carried off the boat and then sat down into the shallows of the beach where the calm waves reached just below my ribs. By this time, half of my leg burst out in blisters. I remember the 2 men ran into this beach house that looked like a restaurant bar, and then they came back with a short and stout abuelita carrying 2 gallons of vinegar, a bag of limes, and a machete. They told me this was going to hurt, and proceeded to chop all the limes in half, and Abuelita grinded the limes into my leg, bursting all my blisterings. I was blacking in and out at this point. Once all my blisters were open and raw, they poured 2 gallons of vinegar on the wound. After this, my memory went in and out, but Abuelita had me sit in the ocean for 2 hours feeding me meat and rum and water to help with the pain. After I was taken back to my hostel where I slept for 35 hours. I was fine, and decided I guess I didn't need to go to the hospital, which as a more adultier adult I don't understand why to this day. Worst pain I've ever felt, with the worst being the venom in my groin. The end. Story 44. Colposcopy. If you ever need one, I'm sorry. Don't skip it, but definitely prepare. I have a very high pain tolerance, thought my appendix rupturing was just I couldn't. They'll tell you to take Tylenol or whatever beforehand. If I'm ever in the position to need one again, I'm definitely looking for a woman OBGYN with a little more empathy. Story 45. Colposcopy, which is the follow-up to an unusual smear results. Not so much painful, but so uncomfortable, and the nurses, bless them, trying to make conversations to distract you while they're rooting around up there. Story 46. I suffered from gallbladder pain for almost a year and a half. Husband went to the ER for lower abdomen pain and discomfort. He was admitted and had 10 centimeters of his ascending colon removed due to appendix and colon cancer, stage 3C. While he was in recovery, I paid him a visit and had a gallbladder attack. I went down to the ER because I was in the hospital already. My bile ducts were compounded, and I almost had my pancreas removed with my gallbladder. 2 days later, I was under the knife. The hospital staff were kind enough to have us in the same room they dubbed the honeymoon suite. I was released 2 days after my surgery. He was released the day after me. I was recommended to take 3 weeks minimum off to heal, but I needed to get back to work. Bills were starting to come in and stack up. I only took a week off. They removed my external drain, and I headed back to work. While at work, my internal stitches let go, and I blacked out. I don't remember the week after that. Husband? 7 chemotherapy sessions injection followed by 2 weeks of pills, then a week off, and off for almost a year. He is now in remission, and all of this happened 10 years ago. Story 47. I had a biopsy to get a sample deep inside some tissue. They numbed the area, but the biopsy needle somehow missed the numbed area. Felt like I had been shot. Much swearing. Story 48. Circumcision in my 20s led to swelling that kept me from peeing, so we had to go to the emergency room and put in a catheter. If you've never had a catheter put in, you probably can't imagine what it's like when your little buddy is full of stitches. I won't elaborate. Story 49. Having my appendix removed was pretty bad. The worst week of my life until I was diagnosed with breast cancer in both breasts. I opted for the mastectomy with reconstruction. Both sides. I was supposed to have 2 surgeries. The first to remove the cancer turds most of the tissue. They placed tissue expanders weight. The second surgery was a couple months later where they removed the expanders along with any remaining breast tissue, replaced them with proper silicone inserts. Then a few months after that, I had a spot that just wouldn't heal. One day, I developed a high fever, was hallucinating. My husband didn't ask questions. He just shoved me in the car, took me to the hospital, where they ran all kinds of tests, and the only hot spot was that spot on my breast that didn't heal. Back under the knife to remove the insert from that side, clean out the infection. Now I'm lopsided. Roughly 5 months later, I get scheduled for surgery to fix my lopsidedness. Surgery went smoothly. Now I'm still lopsided, but not as bad as before. It's been a year half since the first surgery. I wish I could say I'm happy with all of it. And I am happy to be cancer-free. But I miss this with the silicone just doesn't feel right. I'm sure it'll normalize over time, it's just right now I'm not feeling it. Story 50. Hysterosonogram. They dilated my cervix, shoved a catheter up there to inflate a balloon in my uterus, and squirted water in there. All no sort of numbing, pain relief, or anesthetic. Honestly doesn't sound as horrible as it felt. I'm not usually a crier when it comes to pain, but I was on the verge of sobbing. I've had broken bones, been in car wrecks, have had road rash surgeries, etc., but that was by far the worst pain I had felt, period. And am giving birth in October. I am terrified. Story 51. Hysteroscopy, way worse than the uterine biopsy, made my IUD insertion and removal seem like nothing in comparison. I have a considerably high pain tolerance, and I will never let them do either of those procedures again without proper sedation. Story 52. It's a toss-up between 1. Medical treatment for an ectopic. Over the course of a week, I took 4 giant needles in the lower back and had fun back spasms because of it. 2. A hysterosalpinogram, where the doctor didn't have it placed right and had to readjust 0 pain meds. I passed out on the table. 3. Literally every part of IVF. Egg retrieval put me in the hospital with ovaries so big, larger than a grapefruit each. The ER doctor literally said, "Holy, what happened here?" And now the progesterone and oil shots are a blast. We've run out of spots that aren't bruised, so my lower back upper is a painful mess. Bright side, I'm finally pregnant. Here's to hoping it isn't a second ectopic. For the curious, I started out with a needle phobia lol and started donating platelets to try and work through it before starting IVF. Now, about 9 months into IVF, the needle injection count is well up over 100. I no longer fear needles and highly recommend everyone give platelet donation a shot. It sounds a lot scarier than it is, and it's such a worthwhile thing to do. The Red Cross is wonderful to work with. Story 53. Electromyography. I have told my children, who are my medical power of attorney if I am incapacitated, that if that procedure is needed, I must either be put into a full-out medical coma before proceeding, or just let me die. Story 54. Needed investigations treatment for blocked nerve in neuro hospital. I can't remember what the initial procedure was, but what followed I can only describe as some kind of torture ritual. I had 15 blue needles, intramuscular inserted fully into my muscles throughout my arm, and left in while pulses were passed through my arm. The woman doing it was horrible. Didn't even make eye contact with me once. She gave me no warning or explanation what she was doing, and I told her I couldn't carry on after 20 minutes and the 15th one had been inserted. She looked at me like I was something she had stood in and said she was only halfway through the procedure and still had loads of needles to inject. I told her I couldn't take the pain from the needles and she removed them all and told me to leave without looking at me once. I walked out the hospital and burst out crying. It was really traumatizing. I cannot believe I wasn't prepped prior to the procedure. 15 years later, I'm still shocked how utterly brutal it was. Story 55. I've had a couple surgeries, but the most painful was a gum graft to fix a receded gum line. They took a graft from the roof of my mouth and sewed it back on after prepping the site by cutting it up. Hurt worse than my hip surgery, and I wasn't given any pain medication after. Story 56. Number 1 would probably be going through debridement after getting burned over 22 of my body. Number 2 would be a pericardium centesis. Doctor missed where he should have been removing fluid from around my heart and stabbed me in my heart. He removed 2 vials of blood from my left ventricle before he realized he was in the wrong spot. All the while I was awake and telling him to stop, stop, stop and yelling, "This hurts," while the nurse kept saying, "Calm down. They shove a needle up from below your sternum." I asked him if they were going to put me to sleep. "Nope, it'll be over before you know it." Yeah, right. Spent 3 more days in the hospital with a drain tube. He never did apologize. This was a few months after my double bypass surgery. Story 57. Ultrasound and MRI showed breast cancer, so they did a biopsy of the breast and lymph nodes. They used a topical anesthetic, but nothing for the tissue. Crusty old doctor said I wouldn't be able to feel it. I was sobbing in pain, with 2 nurses holding me down. One asked if I was crying because I was scared. No, psycho. I'm crying because I can feel you cutting into my lymph nodes. This was worse than the subsequent chemo, radiation, or the lumpectomy reconstruction. Second place was back labor. Kid was sunny side up and chin up, so her head got stuck in my pelvis. I'd done labor classes, was expecting intermittent cramp pain during contractions, and this was nothing like. It felt like someone was taking a giant corkscrew and slowly twisting it into my lower back pelvis. I couldn't lie down or sit. There was no break between contractions and it was sharp. Ended up with a section. The epidural was their greatest relief. Third place would be emergency vacuum aspiration in ER due to hemorrhaging from a miscarriage. No pain management at all. I was lying in a pool of my own blood. It was all over the floor and the nurses were slipping in it. Doctor stuck a tube into my uterus and I could feel her hoovering up the contents. I was supposed to stay still and it was impossible. Shooting spasms sent up my back. My legs twitched uncontrollably. I hope I never feel anything like that ever again. Fourth is mastitis. Ever feel like you're on fire from the inside? I shoved ice packs in my bra and a desperate attempt at relief didn't help. Being a woman sucks. Story 58. Years ago. A coldocentesis to see if I was bleeding internally. Large needle through the vagina up into the uterine cavity. Apparently it isn't used anymore, and if it is, it's guided by ultrasound. I know why it isn't used. Or, Story 59. The nasal pharyngeal thingy was pretty uncomfy. Oh, and I had something in my eye last month. Doc was digging with a needle and I had to keep very still. It wasn't painful, mostly stressful. Story 60. An HSG to diagnose infertility. Confirmed double tubal blockage. Successfully conceived via IVF shortly after and had a C-section. The HSG was still more painful. Story 61. I had a severe pilonidal cyst that bothered me on and off for years. The last time it was bigger than an egg, just at the top of my butt crack, in constant pain. It was so large that the skin in the area could no longer cover it. It just had an opening and wept always. I didn't have insurance at the time, and I'd been to clinic after cheap urgent care, and it wasn't helping. They'd drain it, it'd fill back up, sometimes in just a day. I finally found a place that was willing to at least cut it open and remove it. What I probably should have had was a full surgery and a revision to the skin back there. But again, no insurance and American. I went to the appointment. I talked to the doctor and the nurse. They told me what the plan was. I'd be awake, they'd remove as much as possible and sew it back together in, hopefully, a better way. Without putting me all the way out and planning to have extra skin, they'd do their best. So they left me to get undressed, came back with supplies. They gave me some numbing shots in the area. And then the strangest feeling, my vision went white. I threw up. Then I turned to look at the doctor. Blood and pus clear up onto his face shield. It would seem that the area under my skin was completely out of room. When he put the injections in, the mass exploded violently. 2 people were absolutely covered in my pilonidal cyst juice. I might be slightly exaggerating, it wasn't as if it was dumped over their heads, but it was bad. Because of the ripping, they had to change their plans for closing me up. They did some stitching and packing gauze that I'd have to come back to have changed every day at first and every other day for a bit after. Let the wound heal itself inside before allowing it to close outside. I want to say it was a little over a month that I needed packing gauze. It hurt the whole time, and without further gross detail, I had to be very careful going to the bathroom and making sure I was extra clean back there. The cyst was at the top of my butt crack, but still very close to the germ factory. I was worried about it getting infected, especially with a piece of gauze hanging out from under my skin in the general vicinity. Good news is that it has been enough to keep it from recurring. I guess the pilonidal sinuses were ripped apart by the rupture, or maybe the doctor was able to remove them, maybe a combination of both. IDK? Either way, it hasn't bothered me in over 15 years, and I'm glad. I know there's way worse, and I'm sorry. Some of you have really been through it, but that's my particularly unpleasant medical experience. It's a combination of pain and the discomfort that comes from it being on my butt.